The human brain is the most complex organ in our body. With a complex network of around 100 billion neurons, it can pass on information through electrical and chemical signals. In this network, it is vital to maintain a perfect balance between excitatory and inhibitory signals, capable of increasing or decreasing the electric activity of neurons. In some diseases like epilepsy, this balance is temporarily compromised. Epilepsy is a neurological disorder characterized by the occurrence of seizures. Caused by an abnormal activity in neurons, these seizures generate transient disturbances in the functioning of the brain. It is estimated that more than 50 million people suffer from epilepsy worldwide. What triggers epilepsy is often unclear. However, it is commonly caused by the presence of genetic or structural alterations or even infectious, immunological, and metabolic causes. Apart from lesions associated with the occurrence of seizures, epileptic patients may also develop anxiety and depression. Seizure onset is mostly sudden and unpredictable, and lasts from few seconds to few minutes. The most common type of seizures is known as focal. These affect a smaller and more localized number of neurons. Focal seizures can occur with or without loss of consciousness and can show up as simple and involuntary movements or as automatic and apparent disproportionate movements. Generalized seizures are caused by changes in the electric activity of a wider number of neurons in both sides of the brain. In most cases, it leads to changes in consciousness. Absent seizures and those known as convulsive seizures are the most common example. If you see someone having a non-convulsive seizure, you should protect them from any harm and support them until consciousness is fully recovered. If you see someone having a convulsive seizure, you should remain calm and control the duration of the seizure. Put a towel or jacket under their head. Put away any objects that may harm the patient and remove any accessories that can restrict their breathing. Whenever possible, put the patient in the recovery position and stay with them until they recover consciousness and normal breathing. Don't put any objects into their mouth or try to pull their tongue. Don't force the person to stay still. Don't give them anything to drink. If the seizure lasts for more than 5 minutes, if it leads to injuries, or if the patient has difficulties in recovering proper breathing, call an ambulance. If it is your first seizure, contact your doctor. Nowadays, most patients can reduce or eliminate the occurrence of seizures through treatments with anti-epileptic drugs. In a smaller number of cases, seizures persist despite the correct treatment and dosage of these drugs. These are known as refractory epilepsies. In these cases, other therapeutic strategies should be considered. Furthermore, the scientific community keeps making efforts to develop novel therapies. In multidisciplinary teams, scientists use advanced techniques to picture and record electric signals in neurons and use cellular and animal models to mimic and study the pathophysiology of the epileptic brain. It is in this context that the EpiEpiNet project was created. EpiEpiNet brings together recognized scientists from 4 research institutions located in Lisbon, Amsterdam, Rome, and Lund. The aims of EpiEpiNet are to promote scientific research in the field of epilepsy and boost the development of new therapies, to exchange knowledge, researchers, and students among partner institutions, to generate debate and awareness in society. Epilepsy requires the attention and care from everyone: health workers, caregivers, patients, scientists, and society in general. Together, we hope to create a positive impact in the fight against this disease.